My name is Anna Schuh, and I'm a professor at the University of Oxford. I'm a hematologist, and I have a lifelong interest in chronic lymphocytic leukemia. CLL, as we call it in the jargon, is basically a cancer of the immune system. And what that means is that the immune system doesn't really work properly anymore when patients have CLL. And this problem gets worse over time. So initially, when patients are first diagnosed, the immune system might still be functioning relatively normal, but then over time, they might get recurrent infections. And so very often we see that patients will need antibiotics much more frequently than a patient without CLL. And that's really one of the signs that the immune system isn't working 100% anymore. There are other signs. Some patients develop what we call autoimmune problems, and they develop antibodies against their own body, against their red cells or against their platelets. And all of this is a signal that this cancerous disease of the immune system is basically impacting on the competence of the immune system and on the function of the immune system. CLL is a cancer of the immune system, and so the immune system doesn't work well. In particular, obviously, also now during the COVID pandemic, what we've noticed is that patients with CLL do not respond to vaccines very well, and so they're not protected by the vaccine. And that really means that they cannot be all together with their family members or their friends and their loved ones, and they can't really onboard the normal life. Everybody else is now going back to normal life, but immune suppressed patients, like patients with CLL, will not be able to join and be on board with the rest of society. Patients with CLL are immunocompromised, and they need to find ways to navigate the system and to avoid COVID-19 infections in the current climate where everybody else is getting back to normal. There are many ways how we can navigate the pandemic as an immune-compromised patient. Most importantly, I think is to be really hopeful and to understand that as the post measures, for example, like the post-exposure prophylaxis are now being used in many countries. Pre-exposure prophylaxis is being used in many countries. These are really valuable measures to increase the patient's and to enhance the patient's own immune system. Obviously, antiviral treatments are now available for COVID, and they're very effective, and they will prevent, hopefully, most severe disease and patients being admitted to hospital and needing intensive care treatment. There's also the patients themselves. Their behavior can still help to navigate the pandemic and to avoid COVID-19 infections. What I always say to patients is if they do not want to attend a party or a meeting, then they have a good reason not to go. Whereas if they do want to go, then they should go, because they also need to have a life. So it's really understanding the risk and the benefits and trying to balance the risk and the benefits, in your daily life. Wearing a mask is not a bad thing, and it's actually obviously very useful in preventing infection. And in many societies and cultures, people have been wearing masks for a long time, and I'm very impressed by the fact that we haven't seen so many patients on repeat antibiotics during the winter. For example, we haven't seen patients being admitted with flu or community-acquired pneumonia, which is otherwise pre-pandemic was a big problem. So So the mask is not just protecting against COVID, it's also protecting against many other infections. And I think that is, I believe, the single most important thing that we can do to wear the mask. And I'm saying we is basically, it's not just the patients, of course, but it's also all of us, because when we're considering the patients with CLL on World CLL Day, then we should really, out of solidarity, wear a mask. When we see somebody in the supermarket or in the train or wherever we are really wearing a mask, we should understand that that patient might be immune suppressed and has got good reasons for wearing a mask, and we should consider the CLL patients, and actually by wearing a mask ourselves out of solidarity. I would like to invite you to consider CLL patients on World CLL Day.